Hey, what's up everyone? Dr. Asher, physical therapist here. Today we are going to be going through the rehab process for a higher level overhead athlete. We're going to be looking at some of my staple mobility exercises, scapular and rotator cuff strength and stability exercises, and then we'll look at why each exercise is important, and then specifically how to fit them into your program if you're a patient watching this, or incorporate them into your athlete's program if you're a clinician watching this. At the end of the video, I will include a chart that shows each exercise specifically with sets and reps and resistances that I would use in this case. The reason that I'm making this video is that my sister is a competitive tennis player, and she reached out to me a few months ago to ask her to show her some exercises to do because she was having pain serving, playing tennis. So I wanted to put together the full length video to show what the exercise portion of the rehab with me would look like and my thought process behind everything. Essentially, we're going to be looking at how to improve overhead stability and improve eccentric rotator cuff and scapular strength to improve that pain for the overhead athlete who's having pain at or beyond point of contact or release of the ball. So for this first video that we're gonna do, it's looking at thoracic rotation as well as shoulder rotation. And these two motions are paired in an overhead athlete like a baseball player, tennis player, or volleyball player. So it is very important that your thoracic mobility, your rotation, and your shoulder range of motion is one, very good range of motion, but also two, you need to control that range of motion. So you're gonna start out kneeling. You can put a pillow underneath your knee if you need to for support and comfort. You're gonna try and push your knee into the wall here. You're gonna have your arms straight out in front of you, and you're going to windmill up and around. Do not touch the wall. Come all the way back, and then twist and open up right to where you're about to touch the wall. Rotate back, windmill, down, around, and twist. And so this is a very, very important thoracic mobility exercise that you're going to want to do if you are an overhead athlete, a thrower, a baseball player, any of those sort of things. This one, you want to do at least 10 to 15 rotations on each side, and you're going to want to do at least 2 to 3 sets of these to really hammer in that mobility. Another exercise that we're going to take a look at is the prone swimmer. This is a very good shoulder and scapular mobility exercise. It also has a strength demand because of that lift off portion that we're going to be doing for the mid and lower traps. So here's what that exercise is going to look like, and we are going to perform anywhere from 2 to 3 sets of about 10 to 12 slow and controlled repetitions for this. Exercise that we're going to take a look at are foam roller extensions with a thrower's bias. So with these, you're going to put your foam roller horizontal on the ground, lay on it with your lower thoracic, and then you're going to extend around the foam roller with your upper back, reaching your arm back into your thrower's position or your serving position, trying to extend and rotate towards that side with the foam roller acting as a fulcrum point. So with this one, you're going to want to repeat anywhere from 10 to 15 times. You can do this on both sides. I find it the most efficient and effective to do this on your throwing side though, because this is where you need to improve that mobility the most. Something to note with this exercise, you want to work segments up your spine or down your spine. You don't just want to randomly kind of roll back and forth. I would either start in your middle or lower thoracic region and work your way up each repetition and then work your way back down. And you're trying to extend your upper back around that foam roller and then bias towards that throwing side, whether you're right or left-handed, or towards your serving side. So that you're getting that combination motion of extension through the thoracic spine and rotation to build the mobility there and to build the stability of that region. So you really need to control the motion. So for the next thing that we want to look at for this overhead athlete with shoulder pain is going to be rotator cuff and scapular stability exercises. And so the first exercise that we're going to take a look at is a side plank or a modified side plank with an active and resisted external rotation. This exercise I would probably throw in as a warm-up or as a corrective after a lot of your other exercises. And this one is pretty difficult, so you're going to go anywhere from 3 to 4 sets and about 8 to 12 repetitions wise. And this one is primarily, again, a stability and rotator cuff strengthening exercise. So for this exercise here, I'm going to show you the side plank with external rotation. I will show you the modified version, and I will also talk about the full side plank position. The only difference is one is you're doing a side plank on your knees. The other one is a full side plank down at the feet. Not much difference as far as the shoulder goes with the modified version. I find it a little bit easier to do, and just positioning wise on my ankles and everything, I can't really do that full side plank yet. So I do the modified version of this. Start with your forearm down. You're really trying to push your elbow and forearm down into the ground and create a lot of stability around your shoulder. Get your body in a straight line, so shoulders, hips, knees, all in a straight line. If you're doing the full version, extend your feet out and you'll go up and do a side plank that way. The modified version, which I'm gonna do, is gonna be here. One thing I do want to note is grab a towel roll. I'm just gonna use the bar pad for now, but this will put your top arm into about 30 degrees to more effectively activate those rotator cuff muscles. And you're gonna take the weight in that top hand. So we got elbow down, body in a line, towel roll underneath the arm, lift that hip up, push into the ground with your forearm and elbow, and then slowly rotate, lift that hand with the dumbbell up and slowly control down, lift up, slowly control down. And this one you're trying to do anywhere from 8 to 12 repetitions. And you really want to make sure that you are doing both sides because the arm that is supporting you is getting all the stability work. The next exercise that we are going to talk about is a very good series of exercises for building scapular, mid-trap, and lower trap strength. And these are staples in a lot of my shoulder programs. So they are T's, Y's, and L's. And they are done in a prone position. You can do them standing with a band, but I like the prone position with dumbbells better because it goes against gravity. And so I just have light 3-pound weights here, and it doesn't take a lot more than that. I wouldn't go much heavier than 2 to 3 pounds with these, especially if you're starting out. So you're gonna start out prone. You can use an exercise ball here. For a T, your arms come out into a T position, thumbs facing upwards, and you're going to lift and squeeze your shoulder blades together. And your main focus here is not trying to shrug up towards your ears. It's trying to stay down and back and just create that T position with the shoulders squeezed back. Our next position is going to be a Y. So you're going to slide up into a Y. Our hands stay in the same position with thumbs facing upwards. And you're going to do the same not shrugging up towards your ears. Lift and really activate between the shoulder blades and get those lower traps working. Lift and back down. So that is what a Y looks like. Now for an L, you're going to start fist down. You're going to do a row backwards and rotate 90 degrees and then press overhead, back, down, ground. So it's row, rotate, press, and reverse it. And all of these exercises, T's, Y's, and L's, I will typically do those in order. I will go T, Y, L, T, Y, L, T, Y, L, 3 sets of 15 for each one, and I will do those towards the end of a workout or towards the beginning of a throwing or serving practice, so that your shoulder blade muscles are really warmed up and ready to go. So one of the final exercises that we're going to look at today is a scapular push-up. This is a very good closed chain scapular strengthening exercise to really build up the strength of that shoulder blade to hold your arm in those positions where they need the most stability and the most support. So with a scapular push-up, there's a couple of different ways you can progress or regress it. A regression would be to do the push-ups, the scap push-ups onto a bench where your hands are up on the bench. A progression of this would be doing them on the floor, but using your feet up on the ball so it's a little bit more unsteady, or using a upside down Bosu ball and doing them with your arms on the floor. So I will show you. We are going to go through just the normal scap push-up. You could also regress it by doing them down on your knees if you needed to, but we are going to demonstrate the full scap push-up today. So you're going to come up into this plank position. You're going to squeeze your shoulder blades together and then push out up through your upper back, trying to round your upper back, and then squeeze back down, push out through your palms. So you're going down and up. And with these ones, you want to make sure when you're going down that you're not shrugging up towards your ears, that your shoulder blades are staying down and back, and then pushing through your upper arms or pushing through your upper back. And this one, if you've been doing any of your scapular cars, I have a video on that I'll link below. If you have been doing those scapular cars with me in the past, this one should be fairly easy for you. If you haven't, I would recommend getting used to moving your scapula by doing some scapular cars and then tackling this exercise. In our third phase and our final phase of what we're going to be doing in a normal rehab session, we need to start strengthening in that overhead position. And so there's 3 different exercises that I'm going to go through now that will show those. The first one is a very important one. It is pretty difficult, but it is very beneficial to improving the overhead stability of the shoulder, and it is called an overhead carry with a silly band. So how you're going to set this one up, you're going to take your big heavy pull-up band or mobilization band, whatever you want to use it for, and a kettlebell. I think this is 20 pounds, 25 pounds, something like that. Doesn't need to be a lot of weight is the point. So you're going to tuck the band through like this, and then you're going to put one end through so that you get this kind of a thing, okay? And you're going to get a lot of bouncing and resistance with it. Okay, the next thing you're going to do, bring it in your hand like this, press up overhead, and then you're going to start walking. And you can set up in the gym if you have a nice longer turf area and you want to try and control that bouncing as much as you can. Don't shrug up by your ear. Control that band. If you really want to challenge it and make it harder, you can give yourself some momentum by dropping the weight like that and then having to stabilize and control it. And just do these until your arm fatigues and you start to lose your form, and then reset. Give yourself a rest, 30 seconds to a minute, and then get back in. Do a couple of rounds of these. These are a very good shoulder stability exercise. So this next one we're going to do is a combination movement for shoulder stability with a kettlebell again. This time the kettlebell though is going to be upside down. So we really have to use wrist strength, grip strength, elbow, bicep, tricep, shoulder, scapula to keep that thing from falling over. Because gravity is going to always want to pull that thing down. So to keep it upright, we need to stay, this has to be perfectly in a line the whole duration of that exercise. That is the goal. So, and I like to do this in a kneeling position. I find you're not going to cheat as much in the kneeling position versus if you're standing. You can generate some momentum by pushing and bending your knees, and so you can cheat a little bit this way. Eliminates as much cheating as possible. So we're really focusing on building that stability of the shoulder. So somewhere between 45 to 60 degrees. Press straight up. Don't shrug up by the ear. Press straight up. So you're going to do 10 in a row. On the 10th one, back to the center, rotate out to 90, back to the center, rotate out to 90, another 8 to 10 of these. The shoulder should be burning, but do 2 to 3 sets of those per side, and you will start seeing strength and stability gains around your shoulder. The last exercise that we're going to look at today as far as throwers and overhead athletes go is this exercise. I actually posted on my Instagram a couple of days ago. It is a eccentric banded external rotation exercise, but it is basically controlling how you slow the arm down after your contact or release point. And this is a way to train that with some resistance. This is also a good one. If you have issues with heavy gripping, you can just wrap the band around your hand like this, and it totally takes gripping out of the equation. So we are going to start grabbing the band. I'll show you with my left hand. So come to where you're going to get into your throwing position or your serving position. So for tennis, it would probably be a little bit different. So you're going to be much more vertical and upright, and then you want to slowly and eccentrically control all the way down. And so you might need to adjust range of motion wise. So you're coming back to your top. This would be near your contact position, probably just before contact because you hit the ball a little bit out in front. So you're going to get to that position without shrugging up towards your arm, hold it, and then slowly and eccentrically control that position down, and then back, control, control, control. You can do different angles at the shoulder because you're not going to get the same arm slot every single time. There's going to be small variations there each time you do this. And each time you're throwing or serving, every single rep is not going to look exactly the same. So you want to train that. So you can do arm angles there. If you're someone that throws a little bit lower down at the side, a little bit wider arm angle, you can come that way and control it out there. You should really feel this in the back, in between your shoulder blades and at the back posterior side of the shoulder. This one is a really good, important exercise for all throwers, all overhead athletes. And again, it is training, not generating velocity, it's generating how to slow down the arm afterwards, because that's where, especially as a tennis player, you're holding a weighted object. So when you're swinging, you're generating a traction force on the arm, And so your scapular and rotator cuff muscles need to counteract that to keep the joint stable. Some other factors to consider in this rehab phase are going to be really focusing on eccentrically strengthening all scapular retractors, downward rotators, upward rotators through either like an eccentric pull-up, a low row with an eccentric focus, a bent over barbell row, a dumbbell row. You could row on a TRX. You can use dumbbells, deadlifting with a lat focus using a band to pull, so you're getting more lat engagement there. Would also not be a bad idea to incorporate in that person's training at this point. Those are the main considerations that I am looking at for this specific situation of an overhead athlete having pain at or beyond that release or contact point. Thanks for watching. I hope you guys found this video helpful. If you did, please like this video and please subscribe to my channel. If you are interested in a way to improve your shoulder control and mobility, check out this video on how to do a shoulder car. Otherwise, I'll see you in the next video. Stay moving and stay healthy.